Hello, dear friends. Have you ever looked down at your feet and wondered if they might be trying to tell you something important? What if I told you that your feet could reveal early warning signs of diabetes, sometimes before you even feel sick? Today, we're going to talk about 9 warning signs in your feet that doctors say you should never ignore, especially after 60. And don't worry, I'll guide you step by step in a simple, clear way. Let's take care of those feet, because they carry you through life. Have you ever noticed a strange tingling in your feet, almost like tiny pins and needles, even when you're sitting comfortably? Or maybe your feet feel numb, as if they've fallen asleep without any clear reason. This might seem like a small inconvenience, something easy to ignore or blame on age, but doctors warn that these changes in sensation can be one of the earliest and most important signs of diabetes, especially in people over 60. When we talk about diabetes, many people think about sugar levels or diet, but what often goes unnoticed is how this condition can affect your nerves. Over time, high blood sugar can damage the nerves in your body, particularly in your feet. This condition is known as diabetic neuropathy, and it often begins very subtly. You may not feel pain at first. In fact, you might feel less sensation instead. That's why numbness or tingling is so important. It's your body's quiet way of asking for attention. Imagine this. You're walking around your home, and you step on something small, like a pebble or even a sharp object. Normally, you would feel immediate discomfort and react right away. But if your feet are numb, you might not notice it at all. That small injury can turn into a bigger problem over time, especially if it goes untreated. This is one of the reasons doctors emphasize paying close attention to any unusual sensations in your feet. Some people describe the feeling as a gentle buzzing. Others say it feels like ants crawling under the skin, and some experience a burning sensation, especially at night. For example, you might be lying in bed trying to sleep, and suddenly your feet feel hot, tingly, or slightly painful for no clear reason. This can disturb your sleep and leave you feeling tired the next day. Many seniors think this is just part of getting older, but it's not something you should ignore. Another common situation is when you notice that your socks feel different, almost as if there's a layer between your skin and the fabric. Or perhaps when you touch your feet with your hands, they don't feel the same as before. Maybe one foot feels less sensitive than the other. These small differences can be early warning signs that something isn't quite right. It's also important to understand that these sensations don't always happen all the time. They can come and go, which makes them even easier to dismiss. You might feel fine for days, and then suddenly notice tingling again. But even occasional symptoms deserve attention, especially if they become more frequent over time. One helpful habit you can start today is a simple daily foot check. Every evening, take a few minutes to sit comfortably and gently examine your feet. Use your hands to feel for any differences in sensation. Pay attention to whether both feet feel the same. You can even use a soft cloth or your fingertips to lightly touch different areas and notice if anything feels unusual. This small routine can make a big difference in catching problems early. Also, be mindful of how your feet feel throughout the day. If you notice tingling after walking, sitting for long periods, or even after meals, take note of it. Keeping a small journal of these sensations can be very helpful when you talk to your doctor. The more information you provide, the easier it is to understand what's happening in your body. Remember, your feet are incredibly important. They support you, help you stay active, and give you independence. When they start sending signals like numbness or tingling, it's not something to fear, but it is something to respect and act on. Taking care of your health doesn't have to be complicated. Sometimes it starts with simply paying attention, listening to your body, and not ignoring the small signs. Because those small signs can lead to big discoveries, and early action can protect your health for many years to come. Have you ever looked at your feet and noticed that the skin seems much drier than before? Maybe even rough or cracked, especially around the heels? Many people over 60 think this is just a natural part of aging. While it's true that our skin tends to lose moisture over time, doctors warn that just dry, cracked skin on the feet can also be an early warning sign of diabetes, and it's something you should never ignore. When blood sugar levels remain high for a long time, they can affect the body in several ways, including reducing the skin's ability to stay hydrated. Diabetes can also damage the nerves that control the oil and moisture balance in your skin. As a result, your feet may become unusually dry, leading to peeling, flaking, and eventually cracks. At first, these changes may seem minor, just a little dryness here and there, but over time, they can become more serious. Imagine this. You step out of the shower, dry your feet, and notice a white, ashy appearance on your heels or the soles of your feet. Maybe the skin feels tight, rough, or slightly itchy. You might think, I just need some lotion, and move on. But if this dryness keeps coming back or gets worse, it could be your body signaling that something deeper is happening. In more advanced cases, the dryness can turn into visible cracks, especially on the heels. These cracks, also known as fissures, can sometimes be deep enough to cause discomfort or even pain when walking. For example, you might feel a sharp sting when you put pressure on your heel, or you may notice small lines that look like they're splitting open. This is not just a cosmetic issue. It can become a serious health concern. Why? Because cracked skin creates an opening for bacteria to enter, and if diabetes is present, the body's ability to fight infection is often reduced. What starts as a simple crack can develop into an infection if not properly cared for. This is why doctors emphasize paying close attention to any changes in the condition of your skin, especially on your feet. Another example to consider: you're putting on your socks in the morning and notice that the fabric catches slightly on your heels. That roughness might seem harmless, but it's often a sign that your skin is becoming excessively dry. Or perhaps you notice flakes of skin coming off when you rub your feet or take off your socks. These are subtle signs, but they matter. Some people also experience itching along with dryness. You might find yourself scratching your feet without even realizing it, especially at night. This can make the problem worse, leading to further irritation and increasing the risk of small cuts or breaks in the skin. The good news is that there are simple steps you can take to care for your feet and reduce these risks. One of the most effective habits is moisturizing your feet daily. After washing and drying them thoroughly, apply a gentle, fragrance-free moisturizer to keep the skin soft and hydrated. However, it's very important to avoid applying lotion between your toes, as excess moisture in that area can lead to fungal infections. You should also choose comfortable, breathable footwear that doesn't rub against your skin or cause additional dryness. Shoes that are too tight or open at the heel can worsen cracking and irritation. Soft socks made from natural materials can help protect your skin and maintain moisture. Take a moment each day to really look at your feet. Check your heels, the soles, and the sides. If you notice deep cracks, redness, swelling, or any signs of infection, it's important to seek medical advice. Early attention can prevent small issues from becoming serious complications. Your feet deserve care and attention, especially at this stage of life. They carry you through your daily activities, your walks, your moments with family. When the skin on your feet becomes dry and cracked, it's not just about appearance, it's about your overall health. Listening to these small signs and taking simple, consistent actions can make a powerful difference. Because when you care for your feet, you're also protecting your independence, your comfort, and your quality of life for years to come. Have you ever had a small cut, blister, or sore on your foot that just didn't seem to heal, no matter how much time passed? Maybe you thought, it's nothing, it will go away. But days or even weeks later, it's still there. Doctors warn that slow-healing wounds or sores on your feet can be one of the most serious warning signs of diabetes, and it should never be ignored. As we get older, it's normal for the body to take a little longer to heal. But when healing becomes unusually slow, especially in the feet, it can be a signal that something deeper is happening inside the body. Diabetes can affect blood circulation, reducing the flow of oxygen and nutrients to certain areas, particularly the feet. At the same time, it can weaken the immune system, making it harder for the body to fight off infections. When these two issues combine, even a tiny cut can turn into a lingering problem. Imagine this situation. You're walking around your home barefoot and accidentally step on something small, like a rough edge or a tiny object. You feel a slight discomfort, but it doesn't seem serious. A day or two later, you notice a small cut or red spot. Normally, this would heal quickly, but instead, it stays the same. Or worse, it becomes more irritated, slightly swollen, or even painful. That's a sign your body may not be healing as it should. Another common example is a blister caused by tight or uncomfortable shoes. Many people over 60 experience this from time to time. Usually, a blister dries up and disappears within a few days. But if you have diabetes or are at risk, that blister might remain, open up, or become infected. You might notice that it looks darker, wetter, or develops a small amount of fluid. In some cases, there may even be a mild odor, another sign that infection could be present. Sometimes these wounds are not even painful, which can make them more dangerous. Due to nerve damage, you may not feel discomfort in the same way as before. For example, you might discover a sore while putting on your socks or washing your feet, without ever having felt pain. This lack of sensation can delay action, allowing the wound to worsen without you realizing it. You might also notice a small scab that doesn't go away, or a spot that repeatedly opens and closes without fully healing. Perhaps there is redness around the area, or the skin looks darker than usual. These are all signs that your body is struggling to repair itself properly. One very important thing to understand is that slow healing wounds on the feet can lead to serious complications if ignored. Infections can spread, and in severe cases, they can affect deeper tissues. That's why doctors emphasize early attention and proper care. The sooner you act, the better the outcome. So what can you do? Start by making foot care part of your daily routine. Every day, take a few minutes to inspect your feet carefully. Look at the tops, the soles, between the toes, and around the heels. If it's hard to see clearly, you can use a mirror or ask a family member to help. The goal is to catch any small problem before it becomes a big one. If you notice a cut or sore, clean it gently with mild soap and water. Dry the area carefully and cover it with a clean bandage. Keep it protected and check it every day. If you don't see improvement within a few days, or if it gets worse, it's important to consult a healthcare professional. Also, choose your footwear wisely. Comfortable, well-fitting shoes can prevent many of these issues from happening in the first place. Avoid walking barefoot, even at home, to reduce the risk of injury. Your feet are strong, but they are also vulnerable, especially when it comes to conditions like diabetes. A small wound may not seem like a big deal, but in this context, it can be a powerful warning sign. Taking action doesn't mean being afraid. It means being aware and proactive. By paying attention to slow healing wounds and treating them with care, you are protecting your health, your mobility, and your independence. Because in the end, it's not just about healing a cut. It's about preserving your quality of life and continuing to walk confidently into each new day. Have you ever looked at your feet and noticed that something just seems different? Maybe the color doesn't look the same as it used to, or one foot feels colder than the other. Perhaps you've even seen slight swelling or changes in shape that you can't quite explain. These changes might seem small or easy to overlook, but doctors warn that changes in color, temperature, or shape in your feet can be important warning signs of diabetes, and they should never be ignored. As we age, our bodies naturally go through changes, but diabetes can affect the way blood flows through your body, especially to your feet. Poor circulation is one of the key issues. When blood doesn't reach your feet properly, it can cause visible and noticeable differences. Your feet might appear pale, slightly bluish, or even reddish in certain areas. These color changes are your body's way of signaling that something may not be working as it should. For example, imagine you're sitting at home, relaxing, and you glance down at your feet. One foot looks normal, but the other seems a bit more pale or even slightly purple. You might think it's just because of how you're sitting or the room temperature. But if this happens frequently or doesn't go away, it's something worth paying attention to. In other cases, the skin may appear unusually red, especially in certain spots. This could be a sign of irritation, pressure, or even the beginning of an infection. For instance, if you wear a particular pair of shoes and later notice red marks that don't fade after a short time, your feet may be struggling with circulation or sensitivity issues related to diabetes. Temperature changes are another important clue. Have you ever noticed that your feet feel unusually cold, even when the rest of your body feels comfortable? Or perhaps the opposite, your feet feel warm or even hot without any clear reason. These differences can happen because diabetes affects the nerves and blood vessels that help regulate temperature. A common situation might be this. You're in bed at night, and while your body feels cozy, Your feet feel cold to the touch. You might even try to warm them with socks or a blanket, but the sensation persists. On the other hand, some people experience a burning or warm feeling that can be uncomfortable and make it difficult to sleep. These sensations are not just minor annoyances. They can be early warning signs of nerve and circulation problems. Changes in the shape of your feet can also be significant. Over time, diabetes can affect the muscles and structure of your feet, leading to swelling or deformities. For example, you might notice that your shoes feel tighter than usual, even though you haven't changed size. Or perhaps your feet look slightly swollen at the end of the day, leaving marks from your socks. Another example is when the toes begin to change position, or the arch of the foot appears different. You might not notice it immediately, but over time, your feet may look wider or flatter. These changes can increase the risk of pressure points, which can lead to sores or injuries if not properly managed. Swelling is also something to watch closely. If your feet or ankles appear puffy or enlarged, especially if it happens regularly, it could be a sign that your body is retaining fluid or that circulation is not optimal. You might press gently on the skin and notice that it leaves a small indentation for a few seconds. This is another sign that should not be ignored. So what can you do to stay on top of these changes? Start by making it a habit to observe your feet daily. Take a few moments in the morning or evening to look at their color, feel their temperature, and notice any differences in shape or size. Comparing one foot to the other can be especially helpful, as it makes changes more noticeable. Wearing comfortable, supportive shoes is also essential. Shoes that fit well can prevent unnecessary pressure and help maintain proper circulation. Avoid tight socks or anything that restricts blood flow. If you notice persistent changes, such as unusual colors, ongoing coldness or warmth, or swelling that doesn't go away, it's important to consult a healthcare professional. Early detection can prevent more serious complications and help you maintain your mobility and independence. Your feet are constantly communicating with you, even in the smallest ways. When you notice changes in color, temperature, or shape, it's not something to fear, but it is something to respect and act on. Because by paying attention today, you're protecting your health for tomorrow and ensuring that your feet continue to support you every step of the way.